So one effective approach that we have for treating knee pain here at the Arthritis Relief Centers is a procedure called a genicular radiofrequency ablation. Now, what makes this procedure so special is that it is minimally invasive and non-surgical. So this is usually indicated for patients with knee pain, those with typical arthritic pain, other causes of knee pain. And with the genicular radiofrequency ablation, under X-ray, we can go to the painful nerves of the knee, and with special electrodes connected to a machine, we can comfortably, in essence, burn these painful nerves at the knee. Typically, pain relief lasts anywhere from 6 to 9 months, and the goal is not only for pain relief, but to enhance function as well as improve quality of life. And a great option with the genicular RFA, or radiofrequency ablation, is that there is still hope for patients who have had total knee replacements. So those who have total knee replacements, typically many times there are no other surgical options. However, this is a great option for those with knee replacements. Again, what we do under X-ray is we simply go in with the radiofrequency cannula and we go to the painful nerves, and under local anesthetic, we gently burn those painful nerves for comforting pain relief. So also with this technique, keep in mind that we are essentially treating those sensory nerves of the knee. So part of a safety protocol that we do during this procedure is we will actually test to ensure that we are not, in essence, treating those motor nerves or affecting those nerves that cause motor movement of the knee. So for the safety check, again, we go to each 3 points of the painful areas of the knee. Once we know there's no motor movement in the knee, it then ensures to us that we're going directly to the sensory nerves of the knee, therefore controlling the pain of the knee and not affecting the movement of the knee itself.